Hey everyone, it's Michael here at Home Health Success Academy, and in this video series, we're talking about home health marketing mistakes and how not to experience them. Or if you're experiencing them, guess what? At least you know now how to handle things. So in this particular video, in this series, we're talking about one of the biggest mistakes ever made, and that's not being able to make that phone call. So a lot of times is we have to understand that in this industry, we have to make these phone calls. We just have to. So for example, in the field, when I'm in the field marketing, on my way visiting a particular facility, I'm already in the phone making a call, planning my appointments for tomorrow or the next week, and so forth. Yes, I use the phone while I'm driving. So do you. I know you're saying, they're going to say, hey, it's illegal to use a phone while you're driving. Yeah, but if you have Bluetooth, if you have earphones, you can, right? Don't text and drive. I may say that to you, but hey, guess what? You're texting and you're driving, more likely. So I want to be able to understand is this, is why is it that a lot of people are scared of making phone calls, okay? Phone calls is the lifeblood of our marketing. If without leads, we cannot close deals. Without phone calls, we cannot close appointments, and appointments brings us leads, and leads brings us referrals. So we have to understand that making the phone call is important. How many phone calls have you made this week? So if you're a marketer, how many phone calls have you made to people that is not referring to you yet? Meaning cold calls. You must be good at making cold calls and must be brave, right? A lot of people are scared of making these phone calls. But guess what? Nobody's going to hit you in the back while you're calling them and they don't know you, right? We spent a whole training series regarding cold calls. Why do we have our own training series just to teach you how to be able to make a call? Because we know it's an important skill. It's a skill that must be learned in order to become successful in this industry. Your administrators must be trained. So you guys who are administrators, or if you know an administrator and you know that they suck at making phone calls, you must tell them about our training for that. They must be good at making these cold calls, right? Because the people that you don't know, those are the people that has your patience. You have to understand that. The people that you don't know yet are the people that has your patience, your referrals, your clients, the people that are going to get you the money for your organization, the people that's going to be able to get you the referrals for you to create success. So a lot of people fear making phone calls. You have to understand that you must train yourself and be ready to be able to make phone calls. So when I deal with a lot of clients that have this fear of making phone calls, so I actually do this one practice with them. So I tell them, okay, grab your phone. So they'll grab their phone. And what we're going to do is we're going to go ahead and have a little game that we're going to play. So I want you to look up 20 rehab facilities that are in a different county that you're never going to service. Now, I want you to use your cell phone to use this, not your company's phone number, but just use your cell phone. And what I want you to do is I want you to be able to call the rehab facility, and when a receptionist answers the phone call, you do this. You say, hey, my name is with ABC Home Health, and actually use the ABC Home Health because we'll just say it doesn't exist more likely. Now, of course, if they exist in your area, don't use it. Just come up with a name of a home health agency, right? So this is ABC Home Health Agency, and I was wondering if I can actually get the name of your social worker who's in charge of the discharges, right? And they're going to give you the name. If they don't, it's just a good practice because they may or they may not give it to you, but you must be able to get that. That's the game, to get the name of that potential social worker and discharge planner, right? If they say that, if they say the name, ask for a spelling, then if they give you what you're asking for, the next question is, do you have their direct phone number or a cell phone I can reach them on? If they won't give you that, if they give it to you, go on to the next question. If they don't give it to you, still go on to the next question. You know what? Thank you so much for your time. Lastly, is there an email that I can email them instead? So if they give it to you or they don't give it to you, it's perfectly fine. You're going to go for the forced question. You say, hey, you know what? I really appreciate your time. I know you're busy. You know what? Also, if you don't mind me asking, I'm taking my son out for a movie. Do you have any, have you watched any new movies recently that you want to recommend? And you're going to be surprised that you're actually going to get a answer most of the time, and they'll gladly share that with you. And most of the time, you'll get an answer fast from people that didn't share with you the information that you asked in the beginning. So what you're doing is you're just creating a practice for you, right? These are the facilities that are not going to refer to you anyway, so who cares if you give them a call, right? But what you're doing right now is you're practicing you asking questions and creating a phone call. And at the same time as you're calling a facility, the same type of facility that you'll be calling, and you want to be able to be used to seeing that you can get the answers that you're asking for when you're doing your research. So you have to understand that cold calling and calling is something that's important, and you being scared of not making these phone calls, it's going to mean that you're not going to be able to be successful of getting new patients and new referrals. So you must learn to be able to answer the phone call and use the phone correctly. We're going to go in a few more videos after this, and at the same time as, training program. It's over 2 hours worth of training. It's going to give you so much information how to be able to handle phone calls. So once again, my name is Michael with Home Health Success Academy. I hope this information has given you some amazing things that makes you guys be able to want to share it with other people that you guys know. Always understand our number is 630-340-8990. If you have any questions, if we can help you guys grow, give us a call. Also visit our website. It's written down there, and if you don't know it, it's homehealthsuccessacademy.com or 10xpatientreferrals.com. Always know that home health marketing is easy if you know what you do.